So, what is a surgical technician? Surgical technicians are there to assist in surgical operations under the supervision of the actual surgeon. They're often referred to as operating room technicians. A surgical technician's primary responsibility is preparing the operating room by setting up the equipment and sterilizing tools that are necessary for the operation. They're also responsible for making sure all equipment is in proper working order, and they may be involved in the assembly of some instruments. They may also be called upon to prepare the patient for surgery by washing, shaving, and sterilizing the areas for operation. In some cases, they may need to transport the patient, observe patient vital signs, check patient charts, and assist the surgical team in dressing for the impending surgery. During the actual surgery, the surgical technician is responsible for handing the instruments to the surgeon. Examples of these instruments include retractors, sutures, sponges, needles, and various other sterilized instruments. Thus, it's very important that they are well versed in the proper usage of each instrument. After the surgery is performed, the surgical technician is then responsible for the cleaning, maintenance, and sterilization of the operating room to prepare for the next surgery. Candidates seeking a career as a surgical technician are generally educated through programs offered by community and junior colleges, vocational schools, universities, hospitals, and sometimes the armed forces. Generally, schooling takes 9 to 24 months. In order to be eligible to enroll in these programs, it's necessary to have a high school diploma or GED. Required courses include health, biology, chemistry and mathematics, anatomy, physiology, microbiology, pharmacology, professional ethics, and medical terminology. Students are also educated on the care and safety of patients during surgery, sterilization techniques, and other surgical procedures. Students also learn about the prevention of infections. Most hospital employers require surgical technicians to be certified, and although it is possible to receive certification through voluntary hospital work, it's extremely difficult to do it this way. All surgical technicians are required to enroll in continuing education and go through a renewal process every 4 years. The annual salary for surgical technicians varies greatly, with individuals who continue their education generally earning more. Salary may also depend on the level of certification and experience an individual has. Technicians who work in hospitals have the potential to earn more based on overtime and on-call opportunities. Surgical technician also varies from state to state. According to a salary study in 2008, most technicians earn between $25,490 and $51,140 a year, depending on the state. There is an ever-growing need for individuals willing to work in the healthcare industry, and especially the need for surgical technicians. With the United States population continuing to rise, so is the number of health-related injuries that are requiring surgery. This means there is also an increasing need for competent technicians. Surgical technicians are primarily responsible for the sterilization and function of the equipment, and failure to provide sterile, safe equipment can have catastrophic effects on a surgery patient, including possible life-threatening infections. Overall, a career as a surgical technician can be a very rewarding one for those looking to work in the healthcare industry. Please visit us at surgicaltechniciansalaryData.com for more information on surgical technician salaries and the training needed to get started in this exciting and lucrative career field.